Welcome to Morning Grounds, Morning Rounds, Stony Brook Medicine's video series where we engage in candid conversations with Stony Brook Medicine colleagues on key initiatives, institutional updates, and expert insights on critical topics. Today, we're joined by Dr. Alison Madden, Chief Medical Officer at Stony Brook Eastern Long Island Hospital. In this role, Dr. Madden is vital in ensuring patients receive the highest standard of care. Her leadership brings together physicians, nurses, researchers, and administrators to work toward improving the health and well-being of our community. Join us as we discuss her approach to leadership and her vision for the future of Stony Brook Eastern Long Island Hospital. So, grab your coffee, settle in, and let's get started. Welcome and thank you for joining us today, Dr. Madden.
Thank you for having me.
To start, can you share a little bit about your professional journey and what drew you to this position at Stony Brook Eastern Long Island Hospital?
Sure. So I grew up as the fourth out of 5 children in New York City. The youngest one is 3 minutes younger than me. She's my twin sister, so kind of cheating, but I still say she's the youngest. I'm older than her. And I studied art history and art in college, didn't do a single science course. Just something I liked to do. I liked working with my hands. I did sculpture, and I love art. Didn't do a single science or math course, and then thought, maybe I want to go to massage school and do acupuncture, and you needed to do some science classes to do that. So I went to Hunter College and started taking science courses post-bac and found a program called the Linkage Program that allowed me to do some research in a lab working on AIDS and HIV treatment. I lived in the West Village at that time. My friends and neighbors were dying from AIDS. It was in the 80s. It was a major problem. And so I was excited to have an opportunity to work in that. I knew nothing about it. And Dr. Kendall Smith, who ran this lab, took me on, taught me so much about immunology. I got to work with bench research, also see the clinical trials and some of the fellows that he worked with. And it allowed me actually to apply to get into medical school early, which I did, and went to med school. In med school, I loved most of my rotations, I'll be honest, but I was particularly drawn to OBGYN. It's a beautiful field. I would tear up when a baby was born. It's just a miracle, and it was so wonderful to be a part of that. And I also liked working with my hands, doing surgery, and I liked the primary care aspect. Back then, primary care was a requirement for OBGYN. It was part of the residency. And I liked being able to do all different things and that continuity of care very much. At the time, I was married, and my ex-husband was a bit of a nomad. He's traveled a lot. He's still traveling out there in the world. And we went to Los Angeles. He was there doing a fellowship. He was a physician as well. And I was at Cedars-Sinai, and I loved it. I had great teachers, wonderful environment. Went into GYN oncology after residency. I loved the GYN oncologists. I loved their approach. They were great teachers. But then I unexpectedly had a miracle of my own with the birth of my first child a few weeks into fellowship, and decided I really wanted to have a time in my career where I could spend a little bit more time with him. I went to Beth Carlin, who was my fellowship director. I thought she would be very mad. She was an amazing leader, but also tough, very tough lady. And instead of making me feel bad, she was so supportive, and then said, I know what you should do. You should do this. You should be our assistant program director. You're so good with teaching and with students and residents. And so I did that. And that was really my first administrative job, right out of residency. And I loved it. And it was great because I got to spend more time with Ian. I had a second child. And then we moved to Hawaii. After I was there for about 8 years, and I went to Hawaii for a few years, which was super fun. Really wonderful place to work. I was at University of Hawaii. They have amazing educational resources. They have back then simulation centers that were run by the Department of Defense. So really amazing stuff they were doing. And then we moved back to the East Coast. My twin sister the youngest child, had a son the same time as my son, and he has a progressive neurologic disease that became apparent. At first, we weren't sure that there was something wrong or not. They were saying maybe he's got cerebral palsy. When I was in Hawaii, it became clear that this was something different, a very rare disease, and it is progressive, kind of looks like ALS. So he has slowly been progressing throughout his life. And I came back, worked in Massachusetts. I was at UMass, and then left after about, I can't remember, 6 years or so to become chief of OB at a hospital just down the road. And from there, my chief medical officer there took a job as a system level CMO and tapped me to join his hospital in New Hampshire as the CMO there. So I took that on. That was really fun. And I was there for 5 or 6 years. And then my sister's son is progressing. So he is wheelchair bound, no longer verbal. He uses his eyes to communicate. He is still just kind of like ALS, still very much in there. You know, it just takes a while to communicate with him. And I really wanted to be closer. So I started looking for opportunities. I don't really want to live in New York City again. I love New Hampshire. I love farms. I like peace and quiet. And I'd been to Greenport because I would take the ferry from New London over. Paul Connor, my CAO at Eastern Long Island, he always says, well, it's hard to recruit people to Eastern Long Island because it's the very last hospital. For me, it was always the very first hospital on Long Island because I came the other way. Yeah.
There you go.
And so I liked it. And I was looking at other places as well in New Jersey and other places in Long Island. But the day I came to Eastern Long Island Hospital, it was a storm. The power was knocked out. So the hospital was dark. You know, the clinical areas obviously are powered by generators. But it's a little bit of a crisis when the power goes out in a hospital. And yet everyone was so warm, welcoming. They were happy to see the leadership team walking around. They were smiling, laughing. That's not always the experience you get as a leadership team walking through. I'm walking through with the CAO and the chief nursing officer, and people are happy to see them, and they're laughing with each other. They're sometimes crisis, people react with stress, and other times they react with camaraderie. And they really did. And when I came over here and I met you and I met Carol Gomes, I remember Carol had a book in her office, The Power of Being Nice. I have often been told I'm nice, and many people mean it as a compliment. Some people mean it as an insult. And it's funny because she could really relate to that. And I felt, wow, this is where I belong, a place where people treat each other with kindness, where patient care is the ultimate goal, excellent patient care. And I really did love academic medicine. So being in a community hospital in New Hampshire, I saw the beauty of that as well, really connecting with the patients. And so this seemed like a perfect fit. And I've been here almost 3 months, and I don't think I was wrong. I think it's great.
That's great.
Yeah.
Well, it's certainly our privilege that you're here, and we're delighted that you are. It's interesting, too, to listen to the progression of your career. It's a combination of what's your intellectual interest, what moves you as a clinician, your interest in trying to make a system better, but also your ability to understand that life has to be balanced, and there are important other things that affect your career, such as family or the people that you work with, the environment that you're working with. And so I think that's very, it's very interesting and very important for people to hear. So thank you for sharing that with us. I want to talk a little bit about your CMO role. So you oversee, of course, a wide range of areas as CMO, from clinical to operational. What kinds of philosophies have shaped your leadership experience?
I've had the great fortune of having so many teachers in my career and mentors. Some of the people that have taught me the most were nurses, like nurses in residency. They taught me so much by their compassion to me, but also their patient focus. They're really focused on providing the best care for the patient. Having people have grace with me during my life transitions. As you said, we go through different things in life. That inspired me. CMO, it's kind of a weird job. It's mostly other duties as required, that line in a job description. That's what it is. And I really enjoy being a part of that, trying to listen and learn from the people I'm working with at all areas of the organization and figure out how can we work together to do better for our patients.
Great. That other duties as required always reminds me of that line from the John Lennon song, "Life is what happens when you're making other plans."
Yeah,
Right?
that's true.
And
Yeah.
the things you don't expect often end up being the things that are important.
Yeah.
But I think how you interact with people, the example that you set, what you verbalize as your priorities as a leader like you do, I think is equally important to any specific task.
Okay.
So, of course, healthcare is advancing rapidly, lots of new technology. How do you incorporate that into sort of your vision for Stony Brook Eastern Long Island Hospital? And how do you balance that new technology with the existing workflow, with the needs of the patients, and with the need that we all have to actually be able to communicate with each other?
I'm so excited about technology in healthcare. It is, I think, going to revolutionize things just as much as new drugs and treatments. The ability for physicians to actually talk to a patient and not be on the computer. When was your last, episode of pain? That type of thing. That doesn't happen with AI. You can have a conversation. It does a much better job of capturing what was said than I would later by typing. I have minimalistic notes and long visits with patients. And it's also has the potential to revolutionize nursing care. I've seen programs where the flow sheets, the amount of documentation in medicine, it's overwhelming, right? What we have to do. And having the ability to have a AI system capture that and allow the nurse to actually spend time with the patient could be amazing for both the nurse and the patient and everybody else, and capture things. It's a lot of lessons to be learned. There's a lot of work in this. It's rapidly advancing. But there's many other areas with technology as well. That Galeen device that Dr. Kim was talking about, that's so cool. Like the things that are coming out in medicine and in the world are amazing. Eastern Long Island Hospital is so fortunate to be a part of Stony Brook because we're going to get on Cerner. We're on a very primitive EMR. It's good. It's very simple. It's almost like paper. You just click note, you write your note. It's a different setup. But I'm excited to be part of an EMR that gives you prompts, pushes people to do the right clinical care, checklists, and I think really advances our ability to provide safe and good care for our patients.
Great. You mentioned before your interest in being in an academic setting. How do you see academics playing a role in Stony Brook Eastern Long Island Hospital and in your role as CMO?
I think it's so fun to be part of an academic institution. At your last town hall, you had scientists talking about work on pain treatments, work on depression, with PET scans. Those things are inspiring for everyone. At Eastern Long Island, we have a large behavioral population. We have a large psychiatric unit. Having advances in psychiatry and the treatment and people affiliated with us working on those, that's really exciting. And that's a wonderful thing for everybody. We have an addiction fellowship that we're starting. It's already started. We're getting 2 fellows next year doing the interviews. And addiction medicine, substance use disorder, that is so very prevalent and so life-altering.
Yes.
And most people recover from it, given the opportunity to have the right treatment. And I'm really excited to be part of a hospital that's a major part of our focus. We have Dr. Pachter bringing in residents, fellows, and having a connection with an academic institution that's doing research. That's the full package. So it's exciting.
I know you've had extensive experience in other health systems, as you described, talking about your professional journey. What do you think sets Stony Brook Medicine apart, and what do you think we can build on here?
I think the leadership sets Stony Brook Medicine apart. everyone seems uniformly focused on excellent patient care. That's not always the state in other institutions, and patient care really needs to be at the focus, whether it's research to help patient care, educational programs to train people. The focus really needs to be on that, and that you could just feel it the second you walked in here. You could feel it at Eastern Long Island Hospital that the patients were at the center.
Mm-hmm. Great. I think you've captured an important facet of what we try to do here at Stony Brook Medicine. You have a large group of people that you're responsible for, and as CMO, of course, you're interacting with not just the physicians, but nurses, other staff, all throughout the hospital and the community. How do you make sure that all the different voices of all of those different people that have a stake in the hospital and its role in the North Fork are heard and their voices really matter?
I'm so lucky to have joined a hospital that has a culture where that's already there. And it's everyone from the EVS staff who are so friendly and will tell you, hey, why don't you do this? That I noticed this. Everyone, to the physicians, the patients, the community. Being part of a community hospital, you get to go around and do different events. I've been at the Rotary, at the library, and learning what the community wants and needs. I went to Peconic Landing, a retirement community. They're very vocal. You don't have to worry about it. But it's wonderful. We need to hear what the community wants and then do our best to meet the needs. And that's wonderful. I think being part of Stony Brook University, the center being part of state system is wonderful because advocacy at the governmental level is very important too, both in the state level and the federal level. Really being a force for change to do better for our patients.
That's great. Now, you also are seeing your own patients as well, right? I think you're the first gynecologist in the North Fork for quite
long
some time.
Yeah.
Yeah. How is that going?
It's wonderful. It's a slow start. I'm in Mattituck, usually on Tuesdays, and it's a practice that has a primary care physician, Dr. Shu, who I see myself. She's wonderful. Highly recommend her.
Great.
And then some specialists. So we have our general surgeon, Dr. Swazik, Dr. Stanton, Dr. Rowe, Dr. Haybacker. These are all specialists that come there. And so it's really a wonderful office to be a part of. Patients are very appreciative. The closest gynecology is Riverhead. Many of them did go to Stony Brook gynecology through Southampton.
Right.
But they enjoy being in their backyard and seeing me, and it's wonderful.
That's great.
Yeah.
I just want to circle back to what you told me about your start. You've studied fine arts and you did your own art. Are you still making art?
In New Hampshire, I did pottery, and so I'm looking around at places to do. I like working with my hands. I'm not actually that talented as an artist, unfortunately, I'll be honest. But I do really like working with my hands. It's kind of meditative to do that. I like gardening, and there's lots of opportunity in Greenport to do that.
That's great.
Yeah.
I'm sure you're being modest about your artistic skills.
But
I also
love our skills.
I also see a parallel between, your interest and ability to create things with your hands and your choice of a career that combines both primary care, surgical procedures, and, there's an overlap there.
I would agree.
I think that's very interesting. Well, thank you very much for joining us today. That wraps up today's episode. I really appreciate you taking the time to share your vision for Stony Brook Medicine and Stony Brook Eastern Long Island Hospital. I know it's in wonderful hands, and we look forward to everything that's ahead. And to all members of the Stony Brook Medicine community, thank you for your continued dedication to discovery, education, and the highest quality patient care. Until next time, keep the coffee brewing and innovation flowing at Stony Brook Medicine.